So thank you, Dr. Daniel, for the lovely introduction. Thank you for the invitation to be here. Today I would like to talk a little bit about body contouring and how we are bridging the gap from devices to the surgery. Let's differentiate first the body contouring and the advanced body contouring, what I actually call when we are doing one step further than just changing the shape and the outline of the body. The traditional body contouring deals with the shaping of the body, changing the shaping of the body, but nowadays, as we all know, we're asked to do more than that. We're asked to change the texture of the skin, to focus into more localized areas, to target more folds and dimples and all of this. So this is what I decided to call advanced body contouring. So this is one example of traditional body contouring, only deals with the shape of the body. And this is one example of advanced body contouring, deals with the dimples, some structural folds, and some adhesion areas. Let's see a little bit about what types of non-invasive body contouring devices we have. As we all know, we have the cryolipolysis that utilizes the controlled cooling to freeze and eliminate the fat cells. The radio frequency, the ultrasound, which is, as a non-invasive device, is the UltraShape, which employs focused ultrasound waves to target and reduce the fat. The combination of that two, which is the device known as Evengelidou, our clinical dietitian. She has lovely results with this device. I will show you some later on. Laser lipolysis, and of course the Sculpt, which is the high-intensity focused electromagnetic technology that, in addition to giving the tone to the muscle, it also eliminates the fat on top of the muscle. Therefore, you can see nice contouring. Now, another non-invasive procedures include the hyaluronic acid as a filler, the fat as a filler, the Selfina as like an automated controlled subcision machine, the manual subcision, and of course one of my favorites is the biostimulation with biostimulator compounds with PLLA. These are the types of body contouring with surgery. The lipabdominoplasty, Brazilian buttock lift, thigh arms lifting, thigh arms liposuction, skin tightening with the similar devices with ultrasound and plasma energy, but for surgical usage this time. Fat transfer and fat redistribution, as we call it, as liposculpture. Now, what are the advantages and what are the disadvantages of each procedure, like minimal invasive from surgically invasive surgeries? We can have, like, for example, small improvements with the minimally non-invasive procedures, like fillers and devices, versus a huge body transformation when we talk about surgeries. Now, the cost for the patient. I would advocate, for sure, that the cost for the patient for minimally invasive devices is much cheaper than the surgery itself. However, if you choose the wrong candidates and you overdo it and you need to do many sessions and everything, I would really advocate the contrary, that it can reach even higher than the surgery itself. The severity of the complications, as we all know, with the plastic surgery, it can be devastating, even life-threatening, if the surgeon is not experienced enough, while the severity of complications with the devices are not reaching to this high level. Now, indications for the non-invasive procedures. Non-invasive procedures are really good when we have small to moderate fat deposits with good skin elasticity and patients with realistic expectations. Patients that do not seek surgery, but only subtle natural outcomes. And the one that I left for last one is the one I will focus in the forward slides. It's when we have skin and fat irregularities or dimples that are not structural. So I will talk a little bit what I call structural adhesions in a while, and then we can further elaborate on this matter. Now, this is an example of non-invasive body contouring PLLA biostimulation. As you can see, this is a very lean patient. I would not have been able to find too much fat. Nevertheless, she didn't want to go for surgery, so we did 3 sessions of biostimulation. And as you can see here, this is, as I was mentioning, 3 sessions with the biostimulation compounds. As you can see, not only volume I don't use it mainly as a volume redistribution, but also to change the structural adhesion bands when these bands are not really so severe. There is no a high severity of these bands. That means it doesn't, the fibrous tissue is not really strong that is attaching the muscle to the skin. I will show you in a while some other cases. This is again with biostimulation. And this is also with our clinical dietitian, Ms. Fatima Al-Kamal, which she did a beautiful session of EM Sculpt. You can see the muscle tone improvement and the decreased fat deposits. The same with the cool sculpting machine. Now, can we have some complications with the non-invasive or minimally invasive devices? Yes, of course we do. The severity is not so as in the surgeries, but we can have less ideal results. We can have like a hyperpigmentation of burns, or you can have some overfilling that exaggerates the dimples when you overfill in an area that you did not do a subcision. And I left last the paradoxical adipose hyperplasia from cool sculpting. Now, this is a typical case with paradoxical adipose hyperplasia. As you can see, there is hyperplasia in the area that should have been atrophied. So it's not a simple, it's a mistake there, it's not a simple healthy hyperplasia. This hyperplasia, these cells, they're not looking healthy. When you cut and you really see how is it in surgery, these are not vibrant, yellow, happy-looking fat cells. They are really dark, and sometimes you can find even light but gray, almost not yellow at all. And they are attached to each other, and they have fibrotic tissue within each other, and they are all together gathered as a block, and usually resembling the probe shape of the cool sculpting. So this case, anyways, this case is not really a case for cool sculpting. I don't know why he opted for cool sculpting. Nevertheless, we need to avoid having such a patient opt for cool sculpting. This is a clear tummy tuck case. Another case of less severe hyperplasia, but as you can see, the patient in the first photo, she's 86 kilos. She lost 14 kilos, yet the abdominal pouch still remains the same, if not bigger. So that means it was expected to be diminished. But when, again, treated her with surgery, this patient at this area, folds that really difficult to penetrate with the cannula. It was really hard to penetrate and do liposuction to these areas. But, and also even after such a successful and beautiful results, you can expect the results to the hyperplasia to come back again. Now, when to refer for surgery? When we do we have all the devices in our mind, we have all the procedures in our mind, but when do we really decide to refer for surgery? In my opinion, it's very simple. When we have moderate to severe fat deposits, like moderate to severe fat deposits, it cannot be treated with a local minimal invasive devices. When the patient wants to address an area that is really half, for example, like the previous patient, she wanted to address an area, the half lower tummy. What about the upper tummy? What about the flanks? You remove, and even if it was successful, and you remove the lower tummy, what is it that you try to seek? A half beautiful tummy and the half bulging and the half flanks are outside, like deforming the shape, the final shape. Whatever it is that you are doing, it will have the patient be unsatisfied because sometimes they don't really know what is best for them. So then, of course, when the rectus diastasis can be confused with local fat deposit. I will show you a case that most of us here, even including me, I would say, yes, this patient would have had like an improvement with any type of minimally invasive device, but I will prove to you that had nothing to do with fat, yet it was everything about muscle diastasis. So don't confuse these two. And of course, my most interesting part for when to refer to surgery is when the adhesions and the irregularities are really structural and are not too simple cellulite. So this is a structural adhesion. This is what we call back roll, bra roll, bra line, or whatever it is called in various countries and languages. This is, like, we need to think logically like anatomist, as Dr. Rami previously is thinking, like, here, why we have these deep lines? In the nasolabial fold, why we have these deep lines? There is a reason behind that. And the reason is because most probably these lines are full of vascular bands underneath. And you don't want to start injecting with these huge vessels. We're talking about 4 to 5 millimeters in diameter. Start injecting little tiny filler injectables. So how we treat this in my hands? In my hands, first of all, I need to identify that these areas are not simple cellulite or folds. These areas are structural. And I borrowed a photo because this has not been studied yet. So I borrowed a photo from my time in microsurgery, because I had some training in microsurgery. And you can see the thoracodorsal artery giving 2 branches of perforators. So these branches, like strongly binded with the perforators. So you're gonna ending up having the bra roll. So these, in my hands, are only treated with huge cannulas, like 4 and 5 millimeters cannulas. You are expecting a high level of bleeding in the surgery within this surface, but you do an actual distraction of the area. You distract the area, and you can never fill this area. It's only a distraction. The same goes for the hip. For the deep hip, what we call the hip dip, we think it's just lack of volume. No, there is no such a thing as lack of volume. Why she has volume here, and she has volume here, and she doesn't have here? Because something is stopping it from being there, and something is stopping it from inflating. And these are the vascular bands. Again, another photo borrowed from microsurgery. If you see the first one, this is what happens. All the vascular bands are within the fascia, and whatever you are doing, even if you feel it or if you try to do anything there, it will never inflate. You need to break all of this, and you need to do it surgically in order to get results like this. This is the case I was talking to you about muscle diastasis. You can think, okay, this patient can have a little bit of fat deposited on the lower tummy, on the central tummy. I will do some cool sculpting. I will do this and that. I can do some injections of enzyme. Nothing can fix this case. This is only just when you fix the muscle diastasis. And trust me, I did minimal liposuction in this case. It's not about the fat. It's about the underlying diagnosis. The same goes here. Structural adhesion cannot be treated conservatively. You need to refer for surgery. Same here. Structural adhesion, bands that are coming from the rectus going towards the skin, and excess fat on top. And of course, because it's surgery, I can address the full front of the patient, that I can harmonize the breast with the tummy and not just the tummy alone, so to treat gynecomastia as well. And the last case that is combining everything together, this is a case that shows the excess skin that cannot be treated with minimal invasive devices, the multiple areas of fat excess, structural irregularities, and of course the hip dip. This is the surgery results on the table and 1 year after. So the most important thing is to identify the proper diagnosis. Why we have this dimple? Why we have this fault? And then we can easily address and properly address without risking of exacerbation of the condition. And please remember, not every dimple is cellulite. Thank you very much.